So I just wanted to come on here and talk a little bit about, some things I've been struggling with in case anyone else has. So something new I've found out this year is that I have aortic root dilation and a descending or ascending aortic root aneurysm in my heart. I'm at a 4.5. They normally don't do surgery for women until 5. And even then, there's no telling how quickly it'll progress. So if you didn't know, I was in the hospital as well on New Year's Day because I got stuck in an arrhythmia episode. They think it was SVT at like 210. I was at 210 for like 20 minutes, which isn't as bad as some people, but it's the first time I've ever been stuck in an arrhythmia. And I was alone. I had to drive myself to the hospital. Really scary. And since then, my doctor has informed me, with your genetic heart condition anyway, you're always going to be at an increased risk for sudden cardiac death. Hearing all this in the matter of 4 weeks, finding all these things out, getting these new restrictions was a lot. So I've been struggling with nocturnal panic attacks and just general anxiety every day, almost crippling. And also grieving the previous life I had. I mean, I was a weightlifter. I used to do CrossFit. I love lifting heavy. It makes me so happy. And now I can't. Because when your aortic root is dilated that much at a 4.5, you're at higher risk for it rupturing, which, causes sudden death. You likely can have like chest and back pain, but if you don't get to the hospital soon, then you're just gone, which is a scary thought. And to prevent this, you need to keep your blood pressure lowered, which is also hard because I have like 2 to 3 panic attacks a night every night. But the main thing is to not strain and not lift heavy. And this can prolong the state of the aortic root dilation to stay where it is so you don't need surgery as quickly. And so now I have to completely change how I lift, and I'm afraid I won't look how I want to. I love looking athletic. I love being athletic. I love being strong. And now I can only walk, bike, do light lifting, if that. I can't really strain myself. Push-pull movements I have to be careful about. And it frickin' sucks. And not to mention the fact that I'm beating myself up trying to figure out if it's worth the risk to lift heavy and just risk it rupturing, which I know sounds stupid, but when you love something that much and you have to give it up because your body just is the way it is, it fucking sucks. I've had many restrictions throughout my life because of my heart condition, my tetralogy flow, and the various things I've had. And so I just wanted to share my struggles. I'm in therapy twice a week. I do CBT. I'm trying now to do exposure therapy because through all of this, I've developed some cardiophobia. And I just want you to know you're not alone. We all have struggles. Life's not fair. We just have to go with the flow of life. I need to remember that this is just a phase of life that I'm in. This isn't my forever state. Because, maybe in a couple years it'll be time for the surgery, and then after the surgery I can get back to lifting and doing the things that I want to. And I've been struggling, just with all the things that my body's been going through, I've been feeling elderly. I mean, I'm 35 and I feel like I'm 80, and I've been treating myself like I'm 80. And it's hard to break that habit and get out of that mindset, but I'm doing my best. It's only been, 3.5 months since all this was laid on me, and this is some heavy stuff. And so my therapist reassures me that I'm making good progress. But yeah, if you're a cardiac patient, if you have anxiety, if you have cardiophobia, just know you're not alone. There's tons of people that have the same issues as you. I went on Reddit and looked up aortic aneurysms and found a bunch of people that had to switch their lifestyle just like I did. And they're doing okay. And so I just need to remember that technology is so much better than it used to be. I'm likely not going to die from this. I just have to take it easy. I can still get in shape. Walking and biking are great ways to stay in shape, especially for my heart. I've lost 30 pounds in the last 2 years, so I'm staying healthy that way. And I just need to remember that I'm doing what I can. So yeah, thank you for coming to my TED Talk. I love you all, and You can beat your fears. You can live your life. You got this.